generally, says, where medicine fails, steel may cure; where steel fails, fire may cure; where fire fails, the disease is incurable. Introduction. Studying the history of epilepsy surgery from Stone Age cranial surgery to the emergence of brain surgery for epilepsy in the 19th century, is fraught with several difficulties. First, it may be difficult to determine if a defect found in a Stone Age skull is the result of a trepanation on a living person, and second, even if it is clear that a trepanation has been performed, it is difficult, on the basis of archaeological skulls, to be certain why it has been performed. More specifically, any effort to describe the pre-modern history of epilepsy surgery is to acknowledge that epilepsy was not always seen as a medical disorder of the brain as we do today. As elegantly summarized by Temkin, the competing view held over many centuries was that epilepsy is a demonical disorder, and seizures were frequently interpreted as evidence of spiritual possession. Not surprisingly, trepanation for treatment of seizures may have been performed for medical reasons, for example in patients with underlying trauma, as well as for magical, religious, ritual, or spiritual reasons, and as a dramatic miracle cure. Although a general discussion of trepanation is beyond the scope of the chapter, it is well recognized that trepanation is the earliest form of surgery known. 3,4 Trepanation of the human skull is the removal of a piece of calvarium without damage to the underlying blood vessels, meninges and brain. 1a Trepanation of the skull is described in written records as early as 1500 BC. A human skull, recovered from a French archaeological site, carbon dated to 5100 BC, from a patient who survived trepanation, represents the oldest example of a successful neurosurgical procedure. The evidence for trepanation begins in the Neolithic, and extends to the present, and comes from every corner of the world. Trepanation is intended to remove a piece of the skull by scraping, gouging, barring and sewing alone, and drilling. There are thousands of samples of trepanation from the ancient world, many of them from Central and Northern Europe, where the operation may perhaps have been most active during the Neolithic, but has been performed continuously ever since to this day. Trepanation was performed in Greece, sometimes with great skill, in Bronze Age careters, Asini, Lernas and Mycenae, and in early geometric Argos. It is noteworthy that the different types of trepanation are not evenly distributed geographically. The scraping method was used more often in Europe, while the South Americans favored sawing. Although not proven, trepanation may have been done to relieve pressure on the brain, to elevate depressed skull fractures, or to remove bone fragments in the case of penetrating head injury. Since the archaeological record shows that there are signs of healing on many trepanned areas, even on prehistoric skulls, it seems that at least some patients often survived the procedure. 3. 5. Many of the examples of trepanation occur on skulls that had suffered injury. It is therefore not unreasonable to consider that among those on whom trepanation was performed were victims of depression fractures who were suffering from post-traumatic seizures or epilepsy. 5. In addition, The apparent indications for atrophination also included depressive symptoms, psychosis, and headaches. 4,5 General surgical procedures used in the past for treatment of epilepsy, such as bloodletting, vascular litigations, or cauterization of limbs, will not be discussed here. The history of modern epilepsy surgery, which began in the 19th century, has been covered elsewhere. 6,7 In this chapter we briefly summarize the evidence of cranial surgery for epilepsy in Europe from the Neolithic to the end of the 18th century, prior to the emergence of modern epilepsy surgery. New Stone Age trepanations for epilepsy? A controversy between Paul Broca and Victor Horsley. In 1886, large craniotomy defects were discovered in ancient skulls from France, most of which are now estimated to be late New Stone Age, or approximately 5,500 years old. These findings raised many questions in the minds of those who found them, and many more in those who reported on them from then on until today. Although it may be extremely difficult to conclusively identify trepanation in archaeological skull specimens, for our discussion of the history of surgery for epilepsy, we need to consider two questions. First, were the observed defects in archaeological specimens, at least in some cases, the result of trepanations performed on the living, as opposed to blade or axe or other injury, depression, fractures, tumors, infections, congenital? 9781841845760, 4 Textbook of Epilepsy Surgery. Defects, or post-mortem rituals or damage? And if so, second, was the trepanation done for treating epilepsy or convulsions? When Pruniers, a medical practitioner who had found the skulls in central France, reported his findings in 1874, he initially concluded that the skulls had been opened post-mortem to transform them into drinking cups for rituals. On second thought, he suggested that they may have been a therapeutic component to trepanation. That these signs and symptoms would disappear following removal of the fractured bone. He initially concluded that the skulls had been opened post-mortem to transform them into drinking cups for rituals. On second thought, he suggested that they may have been a therapeutic component to trepanation. Over time, defects. He initially concluded that the skulls had been opened post-mortem to transform them into drinking cups for rituals. On second thought, he suggested that they may have been a therapeutic component to trepanation. Now Paul Broca, professor of external pathology and of clinical surgery at the University of Paris, who later was to become famous for discovery of the motor speech area in the third frontal convolution, entered the debate. Broca was very much interested in trepanations, since he had the opportunity to examine a trepanation defect in a Peruvian skull a few years earlier. Although Broca agreed with Pruniers that there was a therapeutic goal for doing trepanations, at least in some patients, he strongly disagreed about the specific malady or the theory behind it. Broca pointed out that there was no evidence for associated fractures, and furthermore he did not believe that Neolithic people had any understanding of the physiological functions of the brain nor, for that matter, anything like sophisticated surgery. He concluded, "I think for my part that they were inspired, not by observation, but by superstition." 10. Nevertheless, he considered a therapeutic goal for doing trepanation. In his mind, the goal was to avoid a danger, which could be more or less imaginary. 10. How Broca finally ended up with the hypothesis that the goal of trepanation was to prevent infantile convulsions will be discussed in the next paragraph. Trepanation to prevent infantile convulsions. Broca was convinced that trepanation had been a treatment for epilepsy in the past. In addition, he learned that trepanation was still performed in some parts of the world to exorcise demons thought to cause seizures. He hypothesized that Stone Age humans probably had a similar reasoning much like primitives in modern age. Broca had also read the work of Taxil from Arles, who lived early in the 17th century. Taxil surmised that it was not possible to find an epileptic who was not possessed by demons, and suggested that making a door in the skull would help the demons to elude. Furthermore, Taxil also believed that an amulet made of skull bone would protect from having seizures. To Broca's delight, Taxil commented that epilepsy was very common in children. Broca himself thought that epilepsy was rare in children below age 10, and anyway, he had doubts that trepanation was able to cure epilepsy. 11. Thus by elimination, Broca was left with infantile convulsions, including febrile seizures, he knew, would often get better anyway, with or without trepanation. Broca's theory on Neolithic trepanation in its final form was that the cranial holes allowed the demons causing convulsions in infants to escape. In addition, as suggested by Taxil, Broca proposed that the skulls of those who survived trepanation were thought to have mystical properties and once they died, were cut out for amulets. During the mid-1880s, Victor Horsley would prefer Prunier's concept involving fractures, adding a modern twist of his own, over Broca's demonic hypothesis as we shall now see. Victor Horsley on Neolithic trepanation for epilepsy. Although Horsley never picked up a shovel to dig for prehistoric skulls, he took an avid interest in Broca's findings. He examined and photographed the Neolithic crania in the Broca Museum in Paris, where some of them were stored after Broca's death in 1880. His new variation of Prunier's theory stemmed from his observation that the holes made during the Figure 1.1 a Neolithic skull showing signs of trepanation. The skull was found in a dolmen in France by Prunier's 38. Broca concluded that this skull was trepanned before and after death. 10. Figure 1.2 Paul Broca. Neolithic period were not randomly placed but mostly over the vertex of the head, more or less above the motor cortex as it was then envisioned. In Horsley's mind, that was proof enough that surgical trepanations had been performed for epilepsy. In his own words, by means of this composite arrangement it was demonstrated beyond question that in almost all known instances of this practice the opening of the skull was made over that portion of the surface of the brain which is known to be more especially the seat of representation of movement. This region of the brain, moreover, is the seat of origin of that special form of convulsions which is known as Jacksonian epilepsy, and which so frequently follows injuries to the skull and the brain. 12. Horsley's enthusiasm for his hypothesis of medical trepanations in the late Stone Age must have received a boost by his recent success at the operating table. He had, at age 29, on the 25th of May 1886, operated on his first patient with epilepsy in the National Hospital for the Paralyzed and Epileptic. James B. a 20-year-old Scotsman who was under the care of Jackson and Ferrier, had sustained a depressed skull fracture 15 years earlier. He then had intermittent Jacksonian seizures starting in his right leg. More recently, episodes of status epilepticus had developed. Horsley's skillful use of the trephine revealed a vascularized scar in the superior frontal sulcus, and removal of the scar and some surrounding cortex led to seizure freedom for 1 year. 13,14 Coming back from the operating table where he had cured epilepsy, Horsley felt that his experience with modern trepanation and cortical resection for epilepsy strongly supported his theory on the medical usefulness of Neolithic trepanation for epilepsy. In a certain reputation for the cure of convulsions generally, and as such might have been frequently practiced among savages. 12. Although being devoid of demonology, Horsley's surgical theory was met with considerable skepticisms from the anthropologists whose territory he had clearly entered. Sir William Osler, one of the most respected physicians of his time, clearly favored Broca's theory. According to Osler, 15 the operation was done in infantile convulsions, headache, and various cerebral diseases believed to be due to confined demons, to whom the whole gave a ready method of escape. But to many people then and now, the weakest part of Broca's theory was that it confined trepanation to infantile children. He could not provide evidence for trepanation of skulls of infants. Also, others pointed out that a number of skulls showed several trepanation defects which seemed difficult to reconcile with a medical procedure. 16 In addition, Horsley's suggestion that the holes were made over the motor cortex was challenged. To others it seemed that the holes were indiscriminately placed over the vault of the skull. With all due respect for Horsley's enthusiasm, the enigma of Neolithic cranial trepanation baffles researchers to the present days. We still have many firm views and few conclusive data on Stone Age surgical trepanation for epilepsy, if any. With that, let us continue our search for further, and perhaps better evidence of trepanation for epilepsy in Europe from ancient times to 1800. Trepanation for epilepsy from ancient Greece to the 18th century. The earliest mention of trepanation with a detailed description of different techniques and indications stem from the 5th to 4th century BC and are found in the Hippocratic writings as quoted above. In his aphorisms on injuries of the head, written in 400 BC, he states, in addition to its use in treating head injury, particularly for depressed fractures and penetrating head wounds, trepanation for epilepsy was practiced by ancient Greek and Roman surgeons. 2. According to Temkin, 1 Aretas the Cappadocian, one of the most famous Greek clinicians, began the tradition of trepanning as a treatment of epilepsy or convulsions. It lasted, with ups and downs in its acceptance, into the 18th century. According to Caelius Aurelianus, the Methodist Themeson employed the trephine as a therapeutic adjunct in cases of epilepsy and paralysis. 19. During the European Renaissance, craniotomies used to be performed for epilepsy, especially of traumatic origin, although the purpose of the operation was still to remove bone fragments or a build-up of fluid, or evil air, not to remove epileptogenic brain. In the Sloan manuscript, a collection of medical manuscripts at the end of the 12th century. A person with epilepsy is undergoing both trepanation and cauterization. The legend of the figure is epilepticus curabitur. Cauterization was considered a form of treatment used in the Middle Ages, and perhaps before, when trepanation had failed to control the seizures. 20. The usual site of application was the back of the head or brow, sometimes the spine, chest or